Welcome to another enlightening episode of The Truth About the Plant, the show that takes you on a journey through the world of psychoactive plants and alternative wellness, all while delivering real, actionable insights you crave. I'm your host, Christina Dees. This is my equally talented co-host, Dr. Ryman. And Dr. Ryman, you get to tell everyone why we're here, why we show up every week, and we're so passionate about education.
Well, thanks, Christina. So we are here because it can be so difficult to find good, accurate, science-backed information about cannabis on the internet. Not only is it discriminated against and banned from a lot of social platforms, even the education around cannabis, but there are a lot of people out there that think they are cannabis experts. And so you could Google a question, a really good question that may have implications for your health and safety, and you could get 100 different answers, many of which completely contradict each other. So how do you know the truth? Well, that's where we come in. We are here to answer your most pressing questions about cannabis, all in about 20 minutes or less, so you can get the information you need and get on with your day. You can think of us as your really cool aunties or your kick-ass granddaughters, the women in your life who will always tell you the truth.
Well, I want to welcome everyone to a special episode today. We're diving into the deep of the science of CBD with none other than Hunter Land, PhD. You know, you've heard of CBD, you've seen it everywhere, store shelves, it's all over the internet, it's at gas stations, but do you really know what CBD is? Does CBD actually work? With over 2 decades of R&D experience and 12 years dedicated to cannabinoid research, Hunter has shaped the future of plant medicine from his groundbreaking work at GW Pharma, developing Epidiolex and Sativex, to exploring more than 20 novel cannabinoids and terpenes. We had to bring in the expert for this one. Hunter, you have over 20 years R&D expertise across 25 different indications, 12 years of cannabinoid-focused research, and you're currently serving as the CEO of Lupin. Is it Lupvindal?
Lupvindal.
Oh, Lupvindal. And biosciences. And as an expert in the field of cannabinoid science, you know, you've developed a pipeline of work over 20 novel cannabinoids and terpenes. So I thought we would start with the simple question: what exactly is CBD and how does it work in the body?
Sure. And thank you guys for having me. Nice, flattering introduction. So thank you for that, Christina. Quite simply, CBD is a polyphenol, so that's just kind of a fancy word for a certain type of molecule that is found in the cannabis plant, along with about 150 others that can occur, and they're classified as cannabinoids. One of the key things about, even though they're classified as cannabinoids, they all have very distinct actions. So if I said something was an opioid, like from the opium poppy, you would assume that because it's that classification, it would have similar interactions. I think we all know about the opioid epidemic. That's not the case for cannabinoids. The structural similarities are quite different, and therefore their interactions in the body are quite different. Many people are familiar with delta-9 THC. It's the primary psychoactive component in cannabis, where CBD, while it is psychoactive in terms of it can treat anxiety and seizure disorders, so it does have activity in the brain, it's non-intoxicating. And we've given CBD in humans up to doses of 6,000 milligrams, so quite significantly higher than what you would get in the average over-the-counter product. There's been no indication for abuse liability or that's where it is, and now we're finding out where it can be used to be helpful either in wellness or medicine.
Well, that's where I wanted to go with it. So, you know, there's a lot of buzz about CBD's health benefits, but I want to know, what does the science actually support?
Well, the strongest science is in epilepsy. So there have been 5 randomized controlled trials in epilepsy, specific epilepsies that usually start in childhood, called Dravet syndrome, Lennox-Gastaut syndrome, and tuberous sclerosis complex. While the cause of the seizures is different, the seizure types can be different. CBD universally treated these conditions, not for all patients, but for quite a few patients. We saw seizure reductions from 50 to, in some cases, 100% reduction in seizures, which, you know, that's very positive. And from a medical standpoint, I'm sure, Amanda, as a doctor, you're well aware that that's a pretty incredible thing, but it's not a cure-all. But one thing I would just point out is most of these patients had already failed about 14 different medications. So anytime you're getting any seizure reduction after you've failed every single drug available, that's quite positive. What we don't know is how well does it work in general epilepsy. So the person that just starts having seizures, maybe they have 2 or 3 seizures a year. How well does it work in those cases? And that's something that should be further explored. A couple other areas, there's been a fair amount of research in anxiety. There have been studies done in like public speaking as kind of a surrogate for anxiety. I don't know about you guys, but not we have professionals on the other line here, but I still get a little bit of anxiety when I do public speaking. So they gave a whole host of individuals public speaking tests and with and without CBD, and they performed better with CBD, which can be meaningful because if you take something like an anxiolytic, like Xanax, before you speak, who knows what you'll say and what you'll remember. The question is, how well does this translate to everyday individuals? And there's some nuance with that because CBD, if it's consumed orally, it takes about 3 to 4 hours to get to kind of a peak level in the blood. We would call that Cmax. And to get to Cmax, a lot of people want some sort of immediate onset. So taking something 3 to 4 hours before you anticipate anxiety can be difficult. The other thing is it may be something that you could take consistently, right? So if you have general anxiety or some other mood disorder, it may be something that's taken once or twice a day, possibly for sleep-related anxiety. There could be some more investigation there, but it's not something really that shows benefit acutely just because it takes so long. It is a lipid. It takes so long to kind of get to the levels needed in the system. So those are the
So
two big ones.
I have a
Huh?
question. So anxiety and seizure disorder, right? Two very different types of expressions of medical issue, both related to brain activity. So would you say that when CBD enters the body, is that its main target of effect is in neurocognitive functioning? Or are there other kind of bodily areas? Because we hear about CBD as an anti-inflammatory. I've heard about it as an anti-itch remedy. And so are there other types of processes that it impacts in the body? And how does it do that? So if I take a CBD tincture and put it under my tongue and it enters my body, where is it going? How is that mechanism of action working?
Right. Yeah. No, it's a good point. So CBD is, I kind of refer to it as promiscuous. It just kind of goes a lot of different places. I'll take a step back. In traditional drug development, people, the scientists, they often look for a target that's related to disease. So in anxiety, a target could be GABA. So you might want an allosteric modulator, something that makes the signaling stronger through GABA that causes relaxation. So it's kind of a simple lock and key. Well, plants don't do that, right? So they're not designed to hit on one receptor. They're what we call multimodal. So oftentimes plants don't just function in one area. CBD is pretty interesting because it works on, we know of at least 68 different mechanisms that CBD has, and it doesn't hit any of them like a hammer. So we're not just pounding one receptor site. And I would think of it more as akin to exercise, right? If I said, what's the primary mechanism for exercise? Like you can't just say one thing. In fact, if I said, oh, well, it hurts, you'll get inflammation for a short time, it's tearing muscle fibers, you might say, oh, that sounds terrible, and turns out it's quite healthy. Now, while CBD doesn't cause those negative kind of feedbacks like inflammation, it may alleviate those by downregulating some of your body's release of things called cytokines, like IL-6 beta is a big one, tumor necrosis factor. It's just as bad as it sounds, and those cause inflammation in the body. So certainly CBD's interactions, which we've seen over and over again in animal models, bringing down your own body's inflammatory complexes is one huge impact. And that can be important for things like epilepsy, where you do get inflammation associated with epilepsy. But then something all to do different, like autoimmune diseases, which I have a significant interest in autoimmune and inflammatory conditions. So that's just one component. On the other side, it broadly modulates calcium. Calcium is really important for neuronal signaling. It's also important for seizures. So if you have too much calcium leaving the neuron at one point, then you can cause a spike in the electrical gradient, and lo and behold, you get seizures. So if it modulates that interaction with calcium, it can control pain, seizures, anxiety. At least there are multiple mechanisms that it uses to do that, but that's one that's probably the primary neuronal function it has is through calcium modulation. So we've got two big things and about 20 targets for each of those that explain how it's done. But those are the two major components. I also, the last I'll say on the subject is it looks to be quite beneficial for bone density and bone repair. There have been several studies that look like fracture healing is important. So again, there's this big link with calcium, whether it's for preventing bone demineralization or neuronal signaling. And then on the flip side, we have this anti-inflammatory, autoimmune inhibiting type effect.
Well, that's really interesting because, we have a lot of listeners who are being sold CBD or marketed CBD for a whole host of conditions, right? We were talking about the CBD glove that we saw advertised, where I was like, does it secrete CBD? Does it just get you near the CBD? I've seen CBD pillows. I mean, they're putting it in everything. So it does sound like there's a lot of different illnesses and functions that CBD has in the body. I have an autoimmune condition that's an inflammatory called oral lichen planus. You may have heard of it.
Yeah, I
Yeah,
know it.
so I've got that. And I use CBD inside my mouth to deal with inflammation in my cheek and in my gums. And it's been pretty successful. But my question is, you had mentioned at the outset that one of the things about CBD is that you can give people very, very high doses, right? Because there is not a risk of overdose. There is not a risk of dependence. Those serums and tinctures and things that I see advertised, even in dispensaries, right, usually max out at about 1,000 milligrams per bottle. So, in your opinion, is there a product out there that has enough CBD in it to actually have a therapeutic difference, or are a lot of these products just not even going to scratch the surface based on the amount of CBD that's available?
It's a good question. I often say CBD is not CBD is not CBD, and I mean that a little bit facetiously because the molecule is the same. Unfortunately, the way it's branded and what's in each bottle is not necessarily the same or consistent or even at a therapeutic dose. So most of the doses that have been studied clinically and have shown effect have been somewhere between like 300 and 600 milligrams a day, and higher even for epilepsy. Now that's CBD alone in isolation. Now, you could theoretically have like a high CBD cannabis extract, and it could be below what's legally allowed, 0.3% THC. And that's actually quite a bit of THC in the bottle. So people, it sounds very low if I say, oh, 0.3% THC, but that's actually about 2.7 milligrams per milliliter. So one little dropper's about 2.7 milligrams if it's at 0.3%. That's the starting dose for the FDA approved Marinol, which is a synthetic THC. So it's actually 2.5 milligrams is a pretty hefty dose. So certainly you may think you're getting benefit from CBD or using CBD, but you may actually be getting a fair amount of CBD or some other, or excuse me, THC or some other compound that's driving a lot of the effect. So it's hard to say. The other big issue, you mentioned delivery, gloves, soft gels, they have things, they say self-emulsifying drug delivery systems. They've got all these different things under your tongue. And what we found is, so if you just put it under your tongue, it doesn't just like jump across the oral mucosal membrane. I mean, it's a lipid, it's an oil. So it doesn't, there's no evidence that it gets in your bloodstream any faster. It probably just drains down your throat and absorbed normally. Also, like the type of lipids, for example, if you use medium chain triglycerides, it carries the CBD directly to your liver and it's actually metabolized quite quickly. Whereas if you use something like olive oil or hemp seed oil, it bypasses part of the lymphatic, it bypasses to lymphatic absorption, bypasses the liver, and it can enhance the bioavailability. So even if you're taking 25 milligrams, the different oil being used could have a significant difference in how much is actually getting into your body where it needs to go.
So if I am wanting to use CBD for a medical condition and it's not, something where I'm going to get like Epidiolex or something that's
Mm-hmm.
really measured, and do you have a type of product that you suggest to folks? Like, is it a certain type of oil carrier? Like you'd say MCT over olive oil? Is it using like a CBD vape pen, which obviously you're going to get the effect faster because you're inhaling it into the lungs versus putting it into your body. So if I'm out there and I'm like, I want to try CBD for an ailment, is there a method of delivery that you would recommend, knowing that the ideal method of delivery is probably something that isn't available?
Well, Epidiolex isn't anything particularly special from a formulation standpoint. It's just basically CBD and sesame oil, or excuse me, yeah. So it's not anything particularly inventive. It's got a little ethanol and a little sucralose for sweetener because most kids with epilepsy want something sweet. So from that standpoint, there's not like a big formulation advantage. I would say it's an advantage over medium chain triglycerides or MCT because it's just not as absorbed as other lipids. The big thing I would say is take it with food, right? So we know there's a food effect. So you get about 3 to 5 fold higher exposure after a high fat meal. So if you're taking this on an empty stomach, it's not what people think. People always think, oh, it's like alcohol. If I take it on an empty stomach, I'll get more bang for the buck. It's not like that with cannabinoids. In fact, it's the opposite. And we see this with THC. People say, oh, I take 10 milligrams to sleep, and then one night they have a big burger or pizza and they take 10 milligrams and they get paranoid because they've just effectively increased their exposure. So take it with food. I like different oils aside from medium chain triglycerides. And probably the dose that's on the bottle, if it's accurate, it's probably subtherapeutic from what research says. I mean, we don't know if 25 or 50 milligrams is effective in these conditions. It really hasn't been fully examined. But if you take it with food, then you're probably, with the proper oil, you're probably have a better chance of getting to an effective dose level.
Excellent. Well, that's great advice because I think people unfortunately throw a lot of money away buying products that they
Like
think are,
gummies.
yeah, like gummies or products that are so low dose that
Hmm.
they're not going to do anything, or maybe don't even have CBD in them at all. We've seen studies of a lot of these hemp-based products that are tested and have no CBD in them. And we talk about it like vitamins, right? If I take a vitamin C gummy, I don't know if there's vitamin C in it. My body doesn't tell me. I assume that some regulatory body has ensured that this product has vitamin C, but unlike THC that you can actually feel and know if what you took had THC in it, it's harder to do that with CBD. So, I think that there's a lot of folks out there that buy products just based on the label or what their friend said, without any real knowledge of whether CBD is in there and at a dose that's actually therapeutic.
Couldn't agree more. And you mentioned vaping, and I would just have a little bit of a cautionary tale for two components. One is they have found that there are some leachable metals in some of these heating elements. It's not always of the highest standard. There's also been issues with adding things like vitamin E acetate as stabilizers and getting kind of this mysterious lung illness. And then the third, if you're using a lot of CBD, if you're kind of puffing on this all day, more so than people would use THC, because at some point they're just going to get high, you could probably puff on CBD all day and not get high. Having lipid exposure, and again, deferring to you, Amanda, but having a lot of lipids exposed to your lung isn't necessarily a good thing. Like your lungs aren't really designed to get rid of a lot of oil in the lungs. They're better with aqueous stuff. So, you know, as a delivery mechanism of just getting CBD in, puffing on one of those all day may be problematic. You could get, it's a much easier linear type delivery. You can get to like kind of a stable, steady level from oral ingestion and not have to worry about what's happening to your lungs. I just don't, it may be fine, but we might not know for 5 or 10 years when they say, oh, you know what? All this propylene glycol and lipids in the lungs weren't a great idea. I'm a little bit cautious about what you've been doing.
I completely agree. Christina knows that the delivery method that I encourage all the time on this show is tinctures. Tinctures are my favorite personally for getting products in your system, but good to understand the difference between the carrier oils and for folks to look for something that is not necessarily an MCT based product if they're looking for greater absorption and quicker absorption into the body. But I love tinctures. I use them. My dog uses them. You know, as an alternative to smoking or eating very high sugary gummies. We're big tincture fans on this show.
And
Well, we're
I
right at
think,
the 20. And I wanted to ask a question because I think a lot of people were probably listening to this and then have a question like, well, where should I get CBD? If you're talking about getting quality CBD or tinctures and it's in front of my face everywhere, the grocery store, the gas station, online, it's overwhelming. We just told a horror story last week where somebody just went on the internet and ordered THCA and had a bad experience. Do you have any recommendations for where someone could buy reputable CBD products? I mean, it's not an opportunity to plug anyone per se, but what do you recommend? Like stay away from the grocery
it's a,
store
it's
or
a, it's a tough, I mean, it's really a tough question because everything changes, right? And even manufacturing controls at reputable companies can change over time. So it's really hard to give a recommendation. My recommendation, the safest recommendation, is get a certificate of analysis that is associated with your batch and make sure you're looking at, the right things. The cannabis plant is a bioaccumulator or phytoremediator. It cleans the soil. They even planted it at Chernobyl to help clean up all that nasty nuclear byproduct. So if you've got bad soil and you're growing in poor conditions, all that goes to the plant and then you extract it and you concentrate it, you're at higher risk for high exposures of things like lead and pesticides, et cetera. So, it's not just about am I getting a 50 milligram dose of CBD? It's what else is present? Is this pesticides? Is this heavy metals? And make sure that those batches actually match what you're, because some companies will just put their first batch up of their certificate of analysis and you won't see it again. So I think that's the safest way to do it. And just be careful where you're buying it from because there are some less reputable places to get this stuff maybe at a discount, and it is probably not worth the risk.
yeah, great advice. All right. Well, that's a wrap for today's deep dive into CBD with the incredible Hunter Land. But don't go far because we've just scratched the surface. In an upcoming episode, Hunter's going to walk us through the fascinating and often complicated journey of getting cannabis medicine approved by the FDA. So you won't want to miss the insider look. Until then, if today's conversation sparked new questions, you can always reach out to us, info@mypersonalplants.com. Who knows, your question could be the topic of our next show. And of course, don't forget to subscribe, hit that notification bell so you'll be the first to catch part 2. Stay curious, my friends, stay informed, and we'll see you soon for more plant-powered wisdom.